In this video, we will discuss the pericardium. The pericardium is a thin membrane that surrounds the heart. It helps protect the heart and allows it to move smoothly within the chest during each heartbeat. To do so, we will start with a general overview, followed by detailing the serous pericardium and fibrous pericardium, its means of fixation, its vascularization, innervation, and lymphatic drainage, and finally a conclusion. Let's start with a general overview. The pericardium is a fibroserous sac that encloses the heart and part of the major blood vessels that enter or leave it. It consists of two layers nested within each other. An inner layer, thin and of a serous in nature, is the epicardium. And an outer layer, thick and of a serofibrous in nature, consists of a deep serous layer and a superficial fibrous layer, is the pericardium. The serous pericardium consists of two layers, one visceral and the other parietal, separated by a thin liquid film that facilitates cardiac movements. The visceral layer forms two sheaths around the vessels at the base of the heart. One surrounds the arterial pedicle and extends over its anterior surface to the origin of the brachiocephalic artery. The other sheath, very irregular, surrounds the venous pedicle, forming between the different vessels that make up this pedicle, cul-de-sacs or sinuses, like the Haller sinus, or oblique pericardial sinus, that extends on the posterior surface of the left atrium, between the inferior vena cava and the right pulmonary veins on one side, and the left pulmonary veins on the other. And the transverse sinus. The transverse sinus is located between the two sheaths. The serous cavity extends, forming a channel that allows a finger inserted into the pericardial cavity to bypass the arterial pedicle posteriorly. This channel is bounded by, anteriorly, by the posterior surface of the arterial pedicle, posteriorly, by the anterior surface of the atria, and superiorly, by the right branch of the pulmonary artery. Meanwhile, the parietal layer lines the deep surface of the fibrous pericardial sac, conforming to its shape. After lining the arterial and venous pedicles, the visceral layer reflects and continues with the parietal layer. On the arterial pedicle, the line of reflection is located far from the origin of the arteries. On the venous pedicle, the line of reflection is very close to the point where the vessels enter the atria, except at the level of the superior vena cava, where it is located, anteriorly, about 1 to 2 centimeters above the right atrium. Let's tackle now the fibrous pericardium. This term refers to a fibrous membrane that encases the parietal layer of the serous pericardium externally. The fibrous sac is in contact with the following structures. Anteriorly, it is adjacent to the sternocostal plate, separated from it by the lungs and pleurae, and the thymus. Superiorly, and at the level of the reflection line of the serous pericardium, the fibrous sac separates from the parietal layer of the serous pericardium and extends over the surface of the large vessels, blending with their external tunic, and they are the ascending aorta and the aortic arch, the superior vena cava, and the pulmonary artery. Inferiorly, it is in contact with the diaphragm. Laterally, it is in contact with the vagus nerves and the phrenic nerves, along with the superior diaphragmatic vessels and the mediastinal pleurae. And posteriorly, it is related to the organs of the posterior mediastinum, namely the esophagus, which lies behind the sinus of Haller, the descending thoracic aorta, and the azygous veins. Let's delve now into the means of fixation of the pericardium. The pericardium is connected to the skeletal structures and adjacent organs by fibrous formations known as ligaments. The following ligaments can be distinguished. Right and left phreno-pericardial ligaments connect the anterior sides, right and left, of the inferior face of the pericardium to the corresponding parts of the diaphragm. Superior sternopericardial ligament extends from the posterior face of the sternum to the anterior face of the pericardium. Inferior sternopericardial ligament, also known as the xiphopericardial ligament, connects the xiphoid process to the anterior inferior part of the pericardium. Vertebropericardial ligaments are bundles of connective tissue that reinforce the sagittal septa. They extend from the prevertebral aponeurosis to the upper and lateral faces of the pericardium. and tracheoesophageal pericardial ligaments that extend from the trachea, bronchi, and the anterior face of the esophagus to the nearby parts of the pericardium. Finally, let's discuss the vascularization, innervation, and lymphatic drainage of the pericardium. Starting with its arteries. The blood supply of parietal pericardial layer comes from the following arteries: superior diaphragmatic arteries, bronchial arteries, esophageal arteries, and thymic arteries in young individuals. Whilst the blood supply of the visceral pericardial layer is provided by the coronary arteries. The veins are satellites of the arteries. The veins of the parietal layer drain into the azygous veins and the superior diaphragmatic veins. The parietal pericardium is innervated by branches of the following nerves: phrenic nerves, vagus nerves, left recurrent nerve, and branches from the thoracic sympathetic chain. Whilst the visceral layer receives its innervation from the subpericardial nerve plexus. The lymphatic drainage of the pericardium is directed toward the anterior mediastinal lymph nodes, the posterior mediastinal lymph nodes, the diaphragmatic lymph nodes, and the intertracheobronchial lymph nodes. In summary, the pericardium is a vital structure that plays a crucial role in protecting and supporting the heart. Its intricate anatomy, comprising the fibrous and serous layers, as well as its rich vascular and nerve supply, ensures that the heart functions efficiently within the thoracic cavity.